Hello, I'm Alejandro Cane. I'm a specialist in pediatrics and pediatric infectious diseases and the US Vaccines, Antivirals and Diagnostic Scientific and Medical Affairs Head at Pfizer. In this video, we will discuss the importance of maternal immunization in helping to protect infants against certain viral and bacterial diseases. First, we'll start off with an overview of what maternal immunization is and how it can help protect infants. Maternal immunization is a rapidly expanding area and an effective means to help protect unborn babies from poor health outcomes due to infectious diseases through passive immunity. This is particularly critical during the vulnerable early stages of life, until the time for infants getting vaccinated or until the period of greatest susceptibility has passed. But maternal immunization is not a new concept. The medical community has a long story and experience with it. In fact, the first documented vaccine trial in a pregnant individual was conducted as far as back as 1961, and since then, maternal vaccines have become available for numerous infectious diseases. Extensive research supports the safety and efficacy of widely available maternal vaccines, with numerous studies demonstrating their protective benefits against viruses and bacteria, including pertussis, influenza viruses, SARS-CoV-2, and of course, respiratory syncytial viruses. The science of maternal immunization continues to progress as an important tool for all healthcare practitioners. Let's dive deeper into how it works and what are the current recommendations. Maternal immunization takes advantage of the natural pregnancy process. The maternal immune system helps protect the developing fetus against harmful pathogens before birth by transferring antibodies through the placenta, and after birth through the breast milk. Therefore, boosting maternal immunity represents a valuable health strategy to help protect the infant from severe infectious diseases. When a pregnant person receives maternal immunization, high levels of antibodies are induced that can be transferred to the fetus. But that process, the antibody transfer across the placenta, typically begins in the first trimester, but is minimal. Transfer begins to increase during the second trimester, with the fetal concentration reaching around 50% of concentration by 30 weeks of gestation, and continue to rise from that point until term delivery. With maternal immunization, the transplacental transfer of maternal antibodies to the infants helps to provide protection against infection from birth and through the first 3 to 6 months of life. But what are the current recommendations for maternal immunizations? It is important that healthcare professionals, including prenatal care providers, help their pregnant patients understand the maternal immunizations recommended by the CDC and how these immunizations help protect babies from certain severe diseases. Please be sure to help your patients understand maternal immunization as a recommended and important strategy in helping to protect infants from preventable and serious diseases.